No, we are already live.
Oh.
Okay, I will. Okay, hello everyone. Good afternoon. So today, we actually will talk about common myth about pregnancy. So it is our honor to have Dr. Somas to be with us later to talk about and to address some of the questions for some of the pregnant ladies. So please help to share this Facebook Live link to some of your friends who are pregnant, or maybe they are just deliver, or because later we will also talk about the delivery, and or some of them they might preparing to get pregnant. They also can hear what Dr. Somas can talk about what about the pregnancy. Yeah, because there's we found that there's a lot of myth about pregnancy. So especially some of the mommy group or some of the website, they might talk about some of the questions they raised up by the pregnant ladies. So today is our honors to have Dr. Somas with us. Okay, so we will introduce Dr. Somas first. So we are quite happy to have him to be with us in this evening, in this afternoon. So Dr. Somas is a consultant of obstetrician and gynecologist in Gleneagles Hospital in Penang. So he has his own website, so Penang Doctor pregnancy.drpenang.com. So you can search his website and you can know more about him. And he's a women's health specialist who help women to get pregnant and becoming mothers. So from his website, right, you can see some of the successful stories about the ladies who managed to get conceived, and despite of some of the problem that's very complicated, like blocked fallopian tubes, and mothers who had congenital heart disease who managed to deliver naturally under his care and under his management. This is quite helpful for some of the mothers. Yeah, so you can get all of this information from his website, or if you have any questions for today or later on, you can actually drop down your comment, and also you can actually contact him through the website or through his Facebook Messenger. He's very open for any kind of question. So let's give him an applause. So we are going to invite Dr. Somas. Hello. Dr. Somas.
Hello, how are you?
Hello, thanks for having this Facebook Live with us. We are quite happy to have you around.
No problem. Thank you for inviting me over on a Sunday afternoon.
Yes.
I hope I did not wake you all up or spoil your Sunday afternoon.
No, because you are willing to spend the time with us, okay? And
no problem.
Today, me and Dr. Somas will actually trying to make it more casual and more chillax. Yeah, for all the pregnant ladies to actually trying to ask any kind of question and to address the questions in your mind. Yeah, and we will have some of the questions that's usually and commonly that's asked by some of the mothers, especially in some of the mummies group or some of the website, they tend to ask. Yeah, so we can address from there lah. Yeah.
Yes, okay. It's a Sunday afternoon, so let's not be very formal. You can ask me any questions and don't feel embarrassed or don't feel shy.
Yeah, good. This is how amazing now we have internet and we have Facebook Live and we have all sorts of communications tools to help us to actually reach out for more people. Yeah, yes. So just now we introduced Dr. Somas. So now I'm going to get myself to let you all know about myself. So I'm Chloe. I'm a physiotherapist. So my center is Global Circle Physio and Rehab. We've been started since last year. So we are trying to manage all sorts of pain and also some of the rehab for some of the elderly or some of the stroke patient. But for myself, I'm mothers of two. So because of that, I'm actually looking into women's health. Yeah, so I conducted online antenatal class, more customized to personalized class or sometimes I will conduct some of the education class for confinement center as well for postnatal care. Yeah, so from during this MCO, actually, I invited some of the specialists and also like Dr. Somas to actually get more information about medical and health information. So like today, our topics is about common myth about pregnancy and also delivery. Yeah, if you have any questions about pregnancy or delivery, and also Dr. Somas is very expert in fertility, right? Dr. Somas.
I'm not very expert lah. I try and do my best.
Yeah. This is great that Dr. Sama is very open and very actually care about his patients, and also care about ladies who actually wanted to get pregnant and also want to look for some of the ways to have a better delivery experience. Yeah, so please, everyone can share this link for anybody that who need this information. Yeah, or you want to learn more about the pregnancy delivery, then you can ask any kind of questions. Okay, so we are going to start soon. Yeah. So everyone can grab your afternoon tea or coffee, but some pregnant lady cannot drink so much. If Dr. Somas, if any pregnant your clients ask you, can I drink coffee or tea during my when I'm pregnant? How are you going to advise them?
Okay, coffee and tea, actually it is in moderation, it is allowed. Not too much of coffee. They say 1 to 2 glasses a day is okay.
Yeah.
Tea is also okay, but it is basically, it's got caffeine in it. So we need to be careful. We mustn't be too addicted to a coffee or to the tea.
Yeah.
Number one. Number two, as we know, this caffeine can also cause a lot of urinary incontinence, because it can cause your urine, it can cause your bladder to be full. So the pregnant women already at risk of it. So we normally advise them just 1 to 2 cups per day should be okay lah. If you have 1 coffee in the morning, 1 tea in the evening, I think shouldn't be a problem.
Yeah, it's true. But because some of us really, like for myself, I'm quite like into coffee. So during my pregnancy, I drink once. One.
Yeah, 1 to 2 is still acceptable, no problem, no harm. Yes.
Yeah.
Like even I have to, like, in the morning, but before lunch I've already had about 4 cups of coffee to keep me because we get up early, we start early.
Yeah, your work is quite hectic.
Quite exciting.
Quite exciting. Yes, it's true.
Yes,
okay, it's true. Your work is quite is a long hours work, right? So it's very lucky for us to have you during this Sunday. Yeah, and so we can start with the first questions, the common myths of pregnancy. So a lot of mothers ask me, they say that during pregnant actually don't move so much, because some of the grandparents, they will ask when they heard about you are pregnant, hey, don't move so much. Yeah, what is your advice, and what are the conditions you will actually stop the mother to stop doing exercise or stop certain of activities? What is your opinion?
My first advice is always listen to your grandmother, your auntie and all that. If the older people say don't move, then don't move, lor. Just stay quietly at home.
Really?
Because the old people are very good. But medically, we always advise that exercise is very good. If you do not have any complication, first 3 months of pregnancy is when your baby is moving, when your baby is developing and all that. So sometimes we do not want you to have too much of strenuous exercise. Normal, moderate exercise, it's okay. So that means, we don't want you to go hiking at Moon Gate in Penang and all. But walking, it's okay.
Okay.
Unless you have some issues like, maybe like previously you had some miscarriage, you got bleeding, or you
Okay.
got stomach cramps
Oh,
or
very
something.
bad. Okay.
Then I think we should not exercise too much. But
Mm,
normal walking, some people even go swimming. I think
mm.
it's acceptable as long as there is no bleeding or there's no cramps lah. And
Ah,
then in the second trimester, which is basically from your 3 months to your 8 months,
mm,
also I think no issue. It is very good for you to exercise because
mm,
we do not want you to put on too much of weight during your pregnancy. We want
mm,
you to exercise so you don't have too much of backache and all that.
mm,
And then in the third trimester, which is near the end of your pregnancy,
mm,
just before
mm,
delivery, if you got no issues like no placenta, the placenta is not low
mm.
lying, your
Ah,
baby is okay, yes, definitely we encourage you to do exercise, do your ritual yoga and all that, antenatal classes, because then your delivery is very smooth. Your labor,
ah,
your labor period also is shortened, not very long,
okay.
and you have pain, and then you deliver very fast. So easy for you, easy for me.
Yeah, yeah. It's so just now, Dr. Soma said share a lot of tips lah. So the exercise for is good for mothers who are
Yes.
able to manage their weight during the second trimester, and also because now mother want to slim down faster after delivery.
Yeah.
They worry about they cannot slim down. Yeah,
Yes.
like my experience, the second because my first baby is quite big. Yeah,
Oh,
so
okay.
the second when I have my second baby, then I try to control my diet and I do exercise. I did a lot of exercise as well for
Ah,
myself. Then I keep on telling my gynecologist that I don't want to grow my baby too much. Then I'm
yeah.
very hard to push.
Yes. Correct. Correct. Because our Asian babies, if more than 3 kilo,
Mm,
3.5, 3.8 kilo, is a bit difficult to push.
mm,
Very heavy to carry. Your labor is very long and all that. So keep the
mm,
baby small, so the baby is okay. Also easy for the
mm.
mother, easy for the baby.
Okay. So mainly the sign and symptom they need to watch when they doing the exercise is like spotting, cramp,
Yes. Yes.
and what else? What else? It's just this
If they have any backache or anything, or if
ah
they have like period cramps, if they
ah
have any spotting, any
mm,
bleeding, if
mm,
there's
mm,
vomiting and all, then they must stop immediately. They must go and
mm,
see their gynae. The gynae will do an ultrasound basically to make sure the baby is okay. There
okay.
is no risk of anything lah. Uh,
Yeah, yeah, yeah.
uh,
Just
Sometimes
now,
some
yeah.
people
Mm.
sometimes some people can get some pain over their pubic bone also,
Yes, yes,
because
yes,
the
it's true.
ligaments are being stretched too
Mm,
much. These are the people who do too vigorous exercise
mm,
law, so
mm,
you need to
mm,
slow down a bit lah.
So
Mm.
really it's important that the mothers all must need to know what is the limit and also
Yes,
get a proper guidance on their exercise as well, right?
correct,
Yeah, yeah.
correct.
Don't overdo and don't
Yeah,
underdo.
yeah.
Yeah, yeah.
Sometimes some mothers, because they are so used to doing exercise, doing marathon running and all, they
Ah,
forget
yes.
they're pregnant. They think
Oh,
first 2 3 months they just carry on doing their routine exercise in the morning.
mm,
They go
mm,
jogging and
mm,
all. So those people suddenly they realize, oh, I'm pregnant. I got some spotting. I got some bleeding. Then they have to
mm,
slow down a bit. You should exercise,
mm.
but should slow down.
Okay, understand. Okay, that's great. That's great. Yeah, just now, actually, Dr. Somas mentioned about the pubic pain. Yeah,
Mm.
it's very common, right, in some of the pregnant lady. Yeah.
Yes.
So they have pain. They have this kind of like tailbone pain and back pain during their pregnancy. So some of the mothers very annoyed by these kind of pain. So what are the management that they can ask for, and how they are able to manage themselves? What is your recommendation? What's your advice?
Basically, if they have pain in the first 3 months of pregnancy, the pubic pain or back pain, there's actually nothing much we can do. We just need to make sure that it is not a threatened miscarriage or anything. And then nowadays we also know that our Asian women, Malaysian women, their vitamin D, their calcium are also very low. So they need to take more calcium, more vitamin D, drink more milk and all that. If the backache or the pubic pain is more often there during the second trimester or third trimester when when the baby is getting bigger, then there is this pelvic exercises which we recommend you can do lah. You know, this pelvic exercise basically strengthens your backbone muscle, your muscles at the back and all that, so that they don't feel so painful. One of the things that I recommend sometimes to my patients is like sitting on the wall, you know, like they press their back against the wall so that their back muscles are becoming stronger. But if that doesn't work, then sometimes nowadays we have these maternity belts that we can wear. If the baby is very big, or if they are hunching because the pregnancy baby is big, they cannot stand straight, they're hunching. So sometimes we recommend wearing maternity belts. Maternity belts, you know, it's available at all the pharmacies, as the physiotherapists can recommend also. But those are the things we normally recommend them to do lah.
Yeah, because I see some of the mothers that actually they during their pregnancy and after their delivery they having some of the sciatica kind of symptoms. So it's very hard for them to actually take care of their babies. So they look for physiotherapists for their pain management and to address their pain as well. So and some of the mothers, they actually reluctant to take painkiller.
It is good they don't take any painkiller because number one, nothing is proven to be safe in pregnancy. No medicine. Some of the painkillers are very strong, can affect the baby's heart also, like all the Ponstan and things like that. So sometimes what we recommend is can try Panadol, paracetamol. If the situation is bad, you can massage, but don't use any oil to massage the back lah. You know, don't use medicated oil. Use normal oil or you know, like Johnson lotion kind of thing. But you hot water bottle kind of thing. But try not to take medication lah, because medicine, as we know, is not proven. If you Google about medicine, also they say this can be taken, but take it with precautions and all that. So we need to be careful.
So really the mothers can look for some of the physical management, like for example, just now you mentioned about hot pack and also releasing muscles, the tight muscles, and doing some of the exercise to help. Or if really pain until cannot walk, then need to really look for professions like physiotherapy.
Yes, correct. But the thing is, don't wait until too late. Go and see your physiotherapist. Start early so that you, before the pain start, you can already doing the exercise so that your muscles are already relaxed and not tightened up. So if you wait until then, it takes a longer time to relieve the pain.
It's true. So they actually also can help by some of the pregnancy belt. It's quite common now to actually they put on, but some of the mothers still worry about, like, is it too tight for the baby or not?
No, because I think there's few different types of belts, but I think the belts don't actually press on the baby. they like go on top of the uterus and then below on the belt. So it doesn't press on the baby, but what it does is it supports the back. At the back of the belt, it is quite strong. So that one keeps the back straight, keeps the back muscles very strong. So it doesn't cause any harm to the baby. It's like wearing a seat belt in your car when you drive your car,
Yeah, it's true. What I noticed that I use the pregnancy belt for myself also, because for my work I need to walk a lot, and I also need to do my work daily work. So I use the pregnancy belt to offload the weights of the baby, so that it not keep pressing my bladders, and I don't feel like always want to go to the washroom.
Toilet,
I find that that's quite beneficial with the pregnancy belt.
Yes. Because in the when towards the end of your pregnancy, in the third trimester, the baby's head is there at the bottom pressing on the bladder. So you always feel like you need to go and pee every 20 minutes, every half an hour, and it affects your day-to-day routine and all that. So by using the belt, what happens is it elevates the bladder, the head away from the bladder, so protects the urine bladder, so you don't feel you need to go to the toilet so often. And also helps the backache also lah.
Yeah, it's true. It helps a lot. Yes. So just now, like we also there's some mothers that is talking about, like when they during pregnant or after delivery, when they laugh or cough, there's some urine leak out. When they cough. Then is that normal or not for
it is kind of? Yes, it is normal that's called urinary incontinence lah. It is quite normal in the first 3 months of pregnancy, and also in the last 1-2 months of pregnancy. Basically, because in the first 3 months, when the baby is growing it's growing in the uterus, it's pressing on the pelvic bone, it's pressing on the bladder. So the bladder is in front, bladder is here, the uterus is here, so the uterus is pressing on the bladder as the baby is growing. So every time you cough, every time you laugh, every time you sneeze, some people when they stand up also, there is some amount of urine leaking. So that is very common, don't worry. But we must also check and make sure we are not missing any urinary infection, urinary tract infection, UTI can also cause that problem. So normally, if the patient comes and sees me, we normally do a urine test to make sure no bacteria, there's no protein, there's no sugar and all in the urine. If everything is okay, then normally we advise to keep a urinary diary to see how much of fluid you drink, cut down the tea, cut down the the carbohydrate, carbonated drinks, all the 100 plus and all that, and then try and go to the toilet like every 3 hours or so. Don't wait until the bladder is full lah. And also we advise this Kegel exercise lah. I'm sure you are an expert in Kegel exercise also. So Kegel exercise is basically to make the muscle holding the bladder, the pelvic muscle strong. So normally we do that. We advise Kegel exercise. We teach them how to do the exercise. They go home, control the urine, and then like every 3 hours, 4 hours, control it.
It's true. Because then if for some there's a lot of leakage, like some of them maybe just a bit only. Like some of them, they have a large amount of leakage. So at that point of time, actually, do they need to look for medical advice and also medical management?
Yes, as I mentioned earlier, if there's always continuous urine leaking, yes, we need. I mean, it becomes very uncomfortable for the pregnant mother because she has to wear pampers or she has to wear pad all the time. and then urine leaking all the time. There's urine infection. The vagina can get infection, very sore and all that. So yes, they need to come and see us. What we do, we run a few tests. We check for any infection. We look for any. Is the baby pressing on the bladder? We teach them any exercises. Teach them how to lie down so that it is not pressing on the bladder. And most importantly, we make sure they're not diabetic. There's no sugar in the urine and no bacteria in the urine.
Yes, it's true. It's true because some of the mothers, they found that they feel that it's normal during pregnancy, but they still have some urinary leakage when after delivery also, and some getting worse as well. So it's better to look for doctors to check up. And also need to get some advice in terms of doing some form of Kegel exercise, or really need to restore their core muscles. So for myself, I'm actually practicing Pilates and yoga and Zumba as well. So actually I'm trying to look into some of the exercise, Kegel exercise, and also some of the more functional kind of exercise to help be during the pregnancy and after delivery, some of the mothers to help with their back pain and also some of the urinary incontinence problem.
Yes. So, and the Kegel exercise, as you were mentioning, I think it's good that they start doing before they have any urinary problem. They start doing early in their pregnancy. They learn how to do it early. And also after delivery, continue doing it. Don't only start doing when you have problem. So I think it's good to make the muscles strong, so that even when they deliver the baby, it's also because you need the pelvic muscle, strong pelvic muscle to push the baby out. So they've got about 4 to 5, 6 months to do the Kegel exercise to make the muscle strong, so that they can deliver baby smoothly, no issue, and also continue Kegel exercise even after delivery, so that they have less urinary problem.
Yeah, it's true, because I still remember my first day after delivery, right? The nurses need to bring us to the toilet, and we need to pee for the first time after delivery. So the first time that then I found that I don't know how to pee. And really, the nurse because I need to appreciate how to relax and also how to pee. So it's just now Dr. Somas mentioned about it's very important to learn the proper exercise during the pregnancy, so that you can appreciate the movement and be more aware of your pelvic floor, so that after delivery you can use it. Yeah, you know how to do that. Yes.
To learn about it early, so after delivery you can appreciate it. Because if you want to learn after delivery, I think it's a bit too much of a stress, because you need to look after the baby, you need to breastfeed your baby, you got no time. Some people have delivery pains and all that. So you should learn before.
It's true. It's true. So just now Dr. Somas really know how's the feeling of the mothers that's after delivery and during pregnancy. Is a very caring doctors for the mothers. Okay, now Dr. Somas, we have one question from Priya. Is it how I can pronounce your name, Priya? Okay, if you are having morning sickness and vomiting and afraid of folic acid, which you consume and have been out, so must I consume another tablet?
Hi Priya, how are you? Don't worry about the morning sickness and vomiting. Make sure the folic acid goes in. Morning sickness, basically, it's a good sign. It shows that your baby is growing, your pregnancy is still going strong. Because if you don't have morning sickness, something is not right. Because morning sickness is actually caused by the growth of the baby by the hormones from the pregnancy, the beta HCG. So the more morning sickness you have, I tell my patient, no need to see me, be happy, because that means your baby is good. If you've taken one folic acid and you're not sure whether it has come out again, you vomit, there's no harm in taking another folic acid.
Okay.
It's very difficult to get overdose of folic acid lah. There's no such thing as overdose. Is the only thing you realize is when you go and pee in the morning. After that, your urine is very dark yellow.
Yeah.
Okay, but it's no harm because sometimes in IVF pregnancies we give double the dose of folic acid. In twin pregnancies also we give double dose folic acid. If the mother is about 100 kilo and all that, or the mother previously has got some abnormal babies and all, we also give extra folic acid. So there's no harm. If you think the folic acid has come out in your vomitus, just take another one. If you vomit again, take another one. If you still keep vomiting, then come and see us.
Yeah. So Dr. Somas just now mentioned very a lot of experts' opinion, especially some of the clients that you had, like IVF and also some twins mother. So very important to actually know what to take, and also the diets wise, like some of the healthy and nutrition. Yeah. So some of the so can actually really look for Dr. Somas or some of the experts like dietitian as well.
Dietitians will actually also advise you what you should eat, because some people, what happens is, because they're vomiting, they don't eat so much. They don't eat proper nutrition food, so they don't put on weight. The baby doesn't get enough food. So yes, you can see a dietitian. They can advise you like what kind of food to eat, how much to eat, how often to eat, and all that. Like I also got some patients who, because vomiting, the only food they can eat is Maggi mee. You know, so they only have Maggi cup. But Maggi cup, we know it's very nice to eat. I mean, I also like Maggi cup. But then we must control. We cannot have Maggi cup alone, you see. You have to have your green vegetables. You must have some protein. And you must have some eggs and all that. So you can see a dietitian. They can advise you what to eat, what not to eat, and all.
Because I remember my first pregnancy, when I feel vomiting and nausea when I really look at the milk. So doctors asked me to drink milk, but I cannot take it. So I just replace with some calcium pills. So it's true.
You can because the reason why we advise the milk is for the calcium supplements. So if, of course, milk is the natural way of getting calcium. If you cannot take milk, you can take all your cheese and all that. But if that doesn't work, you can supplement with calcium tablets, vitamin D tablets. Nowadays, there are also people drinking soya milk, soya products. Different flavored milks, vanilla flavor, almond flavor.
Okay. Very good. Priya, did you get your information from Dr. Somas? It's quite extensive kind of information, but we can still chat offline. If you have any more questions, you can ask Dr. Somas offline, okay? So some of the, Dr. Somas, did any of your clients ask you if during pregnant, if I lie on the left side, is it better for the baby? A lot of mothers is asking about that.
That is actually a very common question, and nearly every pregnant mother would want to know how to lie down. Basically, when you lie down in the first 3 months, your baby is very small, so there's no issue which way you lie down. Whichever way is comfortable for you. But as you get bigger, when you cross 4 months, 6 months and all that, we always advise you to lie on your left side. Because when you're lying on your left side, your uterus is not pressing on your main vessels, the aorta and the inferior vena cava, that is the main blood vessels, big ones that are supplying blood to the uterus, to the baby. So if you lie on your back, then you will notice that there's not enough blood going to the baby. So we always advise to lie on the left side. Left side is the best, but some people say they cannot lie on the left side and all that. Then we advise to lie on the right side,
Yeah.
Try not to lie on the back.
Yeah, definitely. It will press on the baby.
Yeah. So sometimes what we do is we advise them to lie on the left and ask the husband to put a pillow at the back or something, so that they don't roll over to lie on their back again lah. Just lie on the left side.
And also maybe can use some of the pillows to help with the support the legs and also support the baby.
Of course.
Yeah,
Of course.
yeah, because a lot of them like during nighttime, some of the lying position, they also have some reflux as well. Some of the mothers have some reflux problem also. Yeah, so sleeping is one of the very important relaxation position for them to rest well during their pregnancy. Yeah. Yeah, so anybody, if you have any questions for Dr. Somas, please list down. So because Dr. Somas have some connection problems, so we will wait for him to come back. Okay. Okay, it's okay. So if any one of you have any question, please write down. Okay. Today we have Dr. Somas with us to address some of the questions in your mind about the common myths of pregnancy. Yeah, and also delivery. If you have any questions, please take down and also write down. Or if you want to ask Dr. Somas offline, you can go into the website pregnancypenang.doctors.com. Yeah, or you can Facebook message him through Somas Penang. So he is very open, and also he is very caring for his clients, trying to address some of the questions in longer time. Okay, Dr. Somas. Just now we just stopped at lying position for the mothers.
Yes.
Okay. Yeah. So some of the mothers actually they trying to discuss with you about their planning for the delivery. Okay. So many of the mothers, they worry about epidural will cause back pain. So what is your opinion?
That's a very good question. Epidural, basically it doesn't cause back pain. It is very good as analgesia for pain, because when you go in labor, they say labor pain is the most painful pain after toothache.
Yes.
You know. So if you have toothache, your labor pain is more painful than toothache. Toothache, so I think most of us cannot take it anymore. So now we have labor pain. So epidural is a very good type of pain relief that is very common and very, very safe to use in pregnancy. It doesn't do any harm. The only thing we must be very, very careful is sometimes what happens is epidural can cause the mother's blood pressure to drop.
Oh, okay.
So when the mother's blood pressure drop, the baby's heartbeat also can drop. So normally we encourage before the epidural, the anesthetist will definitely put a drip up to put a lot of fluid inside to make sure the BP is high, and then only put in the epidural. And so after the epidural has gone in, the mother will not feel any pain from her abdomen onwards, but the contraction will go on and she will deliver very naturally. The only issue, some people at the last part, when the baby is coming out, the mother has to push the baby out. The baby cannot come out on its own. The contraction alone is not enough. The mother has to push. That's why the mothers are most important for the babies. The baby must remember that the mother is the one who pushed the baby out. So sometimes with no epidural, the pain is so strong, mother automatically push. But if the epidural is working very well, she is smiling, no pain, she won't know how to push. Then the doctor has to use instrumentation, either a forceps or a vacuum, to pull the baby out lah. Backache can happen sometimes, but very very rare. Most often, what happens is they get a spinal headache lah. So that is because not enough of fluid, not enough of water. As you know, confinement, sometimes the old auntie will say, don't drink water, only have red bean and all that. So normally we encourage to drink a lot of water to reduce the spinal headache and all that. But backache is there, but very very small group of people.
So importantly is I think is to actually consult the gynae to plan ahead about the birth plan, how the delivery. So especially the last trimester, you can start to plan out and discuss with the husbands and doctors to actually get a mentally prepared for that.
Like some of my patient and the 8 month, 32, 34 weeks itself, they come up with a birthing plan. They say what they want, what they don't want, and all that, and then we sit down and discuss. It is not like everything that they say the doctor has to agree on. So we come to a compromise. You agree to as much as what you want. So then we all are happy. The patient is happy, the husband is happy, the doctor is happy, and we go ahead.
Yes, important is everyone happy and understanding, right?
Yes. Because we don't want them to think that you come to the hospital and then you follow A, B, C, D, E. No, it's both parties must agree to the plan.
Yes, and also importantly is the mother safe and health and the baby healthy. Yes.
That is the number one priority, the mother and the baby.
Yeah, it's true because
father number three.
Father's number three.
Father number three.
Yeah, because Dr. Soma handled quite a lot of clients who have complicated kind of condition and also successfully delivered naturally, right? Because I saw one of the stories from your website. It's quite touching, It's quite touching.
Which one?
The one that who have congenital heart disease.
Okay. Yes. Yeah.
It's quite touched because some of them, because some of the mothers who actually have some of the wish to be natural delivery and actually can consult doctors to actually find a better plan for the health and need to consider a lot of things so need to consult the doctors first.
Because previously if you have a heart disease or if you got some other medical condition, last time, say about 5 years ago, 10 years ago, we try not to encourage you to have normal delivery because it is very stressful to the heart, but now with better medication, better handling and all that, I think normal delivery nowadays is very smooth flowing, no issue.
Yes. So anyone, if you have any questions about delivery or pregnancy, please just drop down your comments or anything you want to ask, please drop down your comment. Okay, we try to have more questions for Dr. Somas. Don't stress you, not to stress you, but you are welcome more questions, right, Dr. Somas?
Yes, can. I'll try and answer as many as possible.
Yes. So when we talk about birth plan, so some of the mothers, they also consider like cesarean. right?
Yeah.
Yeah. Then they start to worry that after cesarean, they worry about cannot go back to their previous lifestyles. Like some of them, they want to go back to their sports activities. So what is
Yes.
your advice for them for cesarean?
Uh, okay. Cesarean section, basically nowadays the suture material that we do for cesarean section, where we stitch up the uterus, the skin, the muscle, all nowadays are all synthetic products. They're very, very strong, very, very good.
Okay.
So now, within 10 days to 2 weeks, most of the cesarean mothers are already walking, going for slow jogging, going on the treadmills and all that, because no issue. But we don't encourage them to do any massage over the front of the abdomen lah, over the stomach. But exercising, going on treadmills and all that is nowadays no problem. Sometimes they also go back to doing weights exercise, carrying weights, minor small sport, but weights is
Yeah.
also encouraged lah. But usually we encourage them after about 2 weeks.
Yeah. So within the 2 weeks, cannot do the massage on the tummy, and
Yeah.
also just do the Kegel exercise will be fine,
Yes.
right? Yeah.
Yes, Kegel exercise must do.
Yeah, must do.
Must do.
It's true.
Ah,
Okay, then
yes.
just maybe ask for doctors and also physiotherapists to advise how to resume back your usual exercise. Yeah.
Yeah.
Okay. Yeah. Okay. Dr. Somas, Charlene have one question. So, if we inject epidural, will it affect our baby and breastfeeding? Some of them they want to breastfeed after their delivery, so they worry about the epidural effect on the baby or the breastfeeding part. Yeah. Do you have any?
Hi.
Mm,
Hello.
mm. Hello.
Epidural basically is usually given while you are while you're in active labor, when you're going to deliver the baby, and it's also the epidural catheter is removed about 2 to 3 hours after you have delivered. So the only, as I mentioned earlier, the only issue with epidural is sometimes it causes your blood pressure to drop. So if your blood pressure drops, it can drop your baby's heartbeat. But that one is while you are still pregnant, while you're still in the labor, you're going to deliver. After you have delivered, epidural has got no issue with breastfeeding. You can breastfeed your baby. You should actually breastfeed your baby as soon as you deliver. Like most of my patients, as soon as the baby is born, we put the baby onto the mother's breast and allow some bonding and all that. So epidural got no issue with the baby and no issue with breastfeeding. Only thing is you will not be able to walk to the toilet immediately. It takes
After
about
the
4
epidural.
hours. Yeah,
Okay.
it takes about 4 hours to 6 hours sometimes lah.
Okay.
Ah.
So you may need to watch for the blood pressure after the delivery.
Yes,
Yeah.
yes. But
And
baby wise, no issue. Don't worry.
and just now, Dr. Somas also mentioned need to watch for your fluids, hydrate yourself after the delivery.
Yes, correct.
So
You
that
must always keep yourself well hydrated.
yeah, it's true. It's very true. Yes.
Yes. Yes.
During the pregnancy and after delivery, it's very important to keep yourself hydrated. Yeah, because some of the mothers they will actually think about because they have swelling legs so the leg is quite swollen and they don't dare to drink more water. So what's your
Okay.
advice?
No, they should drink more water. The leg swelling before delivery is basically because the blood from the leg cannot flow up so much to this one, because the head is pressing on the pelvis. So the blood flow is not so smooth. So normally what I do is we advise them to put their legs up lah. So if this one, put the legs up, put a pillow under the legs at night when you watch TV and all that. Let the leg be above the pelvis so the blood flow can flow down. After delivery, after delivery is most often because sometimes when we deliver, you lose a lot of blood. So when you lose a lot of blood, your anemic also can cause your leg to be swollen. So normally we encourage you to take some iron tablets, eat more green vegetables, beetroot juice, things like that,
Oh,
and
okay.
then the leg swelling will reduce.
Okay.
Definitely, you shouldn't cut down on the water, lor. Nothing to do with water. Don't
Yeah,
worry.
nothing to do with water. Yeah, must replenish yourself with water. Okay, Charlene
Yes.
has quite a number of questions. Like next question is, if when inject the epidural, we still feel the pain. Charlene, can you tell us how many weeks or how many months of pregnancy so that Dr. Somas also can address some of your questions lah. Okay, if inject epidural, can we still feel the pain? I don't know.
Usually, 90% of the time when the anesthetist gives you, the epidural is given by the anesthetist, not by the gynae, not by the obstetrician. The anesthetist will give the epidural. So 90% there is no issue. They will not feel any pain. They'll only feel the pain at the last part when the baby is coming out.
Yeah,
Okay, when the baby is crowning, when it's coming out, yes, that part you can feel the pain. If
Okay.
you still feel pain and during when the epidural has already been inserted and you still have the labor pain, the contraction pain, that means the epidural is not working, lor.
Yeah,
Then we need to change and see what happens. That means the epidural is not working. It's not necessary because sometimes if the mother is very big size, a bit obese, more than 90, 100 kilos, sometimes it's a bit difficult for the anesthetist to give the injection for the epidural to work.
Okay, good. So Charlene is currently 37 weeks of pregnancy, so it's close to delivery soon. So
Yes.
if you have any questions about delivery, you can ask Dr. Somas offline, and I hope that you have a smooth delivery. Yes.
Yeah. All the best.
Yeah, so it's really, however, maybe you are the first one or the second pregnancy, you still, when come to close to the delivery stage, so you will still feel the same tension and also feel excited about it.
The same nervousness you will feel.
Yeah, nervousness, yes.
But then, as they say, each pregnancy is different. So each pregnancy is very interesting, and it gets more exciting for the mothers. So it is normal to feel nervous, and it is normal to feel excited as you get closer towards your due date.
Yes, it's true. Yeah, and some of the delivery may take long hours. Yeah.
Yeah.
So if they have been through long hours of delivery, right? So some of them may have like a tailbone pain. Some of my mothers actually told me they have tailbone pain.
Yes.
Yeah. So what is your advice for that?
Okay, the thing is, the labor pain normally is very standard. It's about 6 to 8 hours. If it is longer than 6 to 8 hours, that means either the baby is too big, or the contraction is not very strong, or the uterus is already very tired, and all the muscle is very tired. That's why the labor is not progressing so well. That's why it's very long pain. The tailbone pain is there because when the baby is delivering, it has to come down, it has to hit the bottom and then only come out. So the hitting the bottom is hitting the back of the tailbone is there. There's nothing much we can do. We give after delivery, we normally give some painkillers like Voltaren, Ponstan, Panadol, paracetamol. We can also advise exercise, after you have delivered.
Yeah.
to strengthen your back and all that.
Yeah.
But
Yeah.
usually the pain will settle within 24 to 48 hours. Lor.
Uh, yeah.
Mm.
Because I have some mothers that's come after like maybe 6 months after delivery. So
Ah,
if that point of time may need some form of pain management, and also we will
yes.
do some form of manipulation or mobilization for the tailbone of the
Yeah.
pelvis.
That
Yeah.
that one you need the exercise, the physio exercise and all that lah.
Yes.
Then we
Yes.
also need to assess whether her calcium, her vitamin D,
Ah. Correct.
is
Mm.
it low or not? Because if the levels are very low, they can have longer pain. Lor.
Like the joint pain, like the joint pain.
Yeah, yeah.
It's true.
All the
It's true.
fingers, the legs, and all that can have pain.
Yeah, yeah. So I think Dr. Somas is very care about the mothers who have really all sorts of information about like food, how they take, and also what are the how they are maintain their diets, and also care about their feeling, try to make them happy, right, Dr. Somas?
Yes, of course. Everyone must be happy. The patient, the mother, the doctor, the father, all
Yeah,
must be happy.
yeah, it's true. Okay, and during this COVID-19, right?
Ah,
For some of the mothers, they will worry about this infection, and also they worry about go to the hospital for checkup. Yeah.
yeah.
So did you do teleconsultation for your clients?
We have started doing teleconsultation. Gleneagles Penang has started
Mm,
doing
mm,
teleconsultation,
mm, mm,
but
mm.
our teleconsultation is only for our old patients lah. You know,
Oh,
follow
okay.
up patients who cannot
Mm,
come because of
mm,
the COVID-19.
mm,
What we do is we sometimes talk to them on the phone and all
mm,
that. If they want to delay their appointment, if they
mm,
don't have any risk factors like no
mm,
hypertension, no diabetes, normally sometimes we see them every 2 weeks or 3 weeks, but because they cannot
mm,
come, we can postpone to 1 month.
mm, mm,
Sometimes patients on the mainland who cannot come, we tell them to go and see the doctor near the clinic, near their
mm,
home,
mm,
just to check the BP, just to make
mm.
sure the baby is okay and all that.
Mm,
But
mm,
if but they but we still get patients coming in
mm.
once a month for checkup because all COVID or no COVID, we need to still scan the baby to see if the baby is growing well or not.
Yeah,
So
yeah,
yeah, you can delay.
yeah,
What we do is we don't. I don't have so many patients all at one time. Like my nurse, what she does is she spread them out. Loh.
yeah, it's
So
true.
the patients don't have a lot of waiting time. They come
Mm,
in, they see, and then they go.
mm,
No
mm.
waiting, no hanging around the hospital. Loh.
Yeah, this is how we can ensure that the mother is safe when they go for the
Yeah.
appointment as well.
Yes.
And
Yes.
you also did a 3D and 4D scan for the mothers, right?
Yeah. 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 Yeah.
Ah,
I also do 3D, 4D scans
yeah,
for all the pregnant mothers after 28 weeks. So sometimes they want to see the baby's face.
yes.
Medically, we want to see whether baby got any cleft lip, cleft palate,
Mm,
any problem with the
mm,
heart and all that. But
mm.
sometimes, most often, they want to see whether the baby looks like the father or look like the mother and all that. So yes, we do all these 3D, 4D scans. Now
Ah,
GMC is also having a package lah. I think I think a promotion 4D scan
mm,
promotion lah for the
okay.
pregnant mothers also, so
Yeah,
they
to
can check out the
yeah.
website GMC website or my website and
Yeah.
contact the nurses lah. Yeah.
Importantly, also scan the all the organs is
Yeah,
in good
yeah, yeah. We scan all the organs.
condition.
We look at the fingers, the nose,
Yeah.
the heart, the kidney, and then
Mm,
sometimes they
mm,
want to know whether it's a boy or girl, the
mm,
legs and all
mm.
that. Yeah, yes, yes, of
Yeah.
course. We
And
do
some
all
of
the
them,
anomaly
yeah,
scan.
yeah. So is that true that when close to delivery, right? Nowadays, the mothers need to go through the COVID-19 test first.
Yes, because all patients that come into the hospital
Mm,
for delivery or for
mm,
any operation need to do
mm,
the COVID-19 testing.
mm,
So that if they are positive or high risk of being positive, then we can separate them isolate them so that the baby is also safe. There is no contamination and all that. So most of the patients, like 1 week before their due date or something, we just do the swab test lah, the COVID test, just to assess and see whether are they high risk or low risk or not. No? Because all pregnancy mothers are considered as high risk.
Yeah. Oh, okay. Yeah, I saw you post the photo of you wearing the full suits of the
PPE.
personal protection gear.
Yeah.
So it is to ensure the mother's safety and
and the baby. That one, the mother had come in and we needed to do emergency surgery, cesarean section, and we didn't have time to test whether she's positive or negative. And that time was during the peak COVID, during the main MCO period. So to be on the safe side for mother, baby, for doctors, everyone, so we had to go full PPE suit, but the report came out as negative, so we all are very lucky. But it is not an easy to wear the suit. To wear the suit itself takes about 20 minutes to half an hour.
Really?
But you got about 4 layers of clothes to wear.
It's so hot.
Yeah, it's so hot and you cannot see and you're sweating also.
It's true.
I hope I don't have to wear it again, lo.
Yeah, definitely. We hope that the COVID-19 will be over, because some of the pregnant mothers actually quite worried about the COVID-19 now. And quite cause some nervous also. Feel nervous about that. So we are quite happy to have Dr. Somas. So Sherlyn, thanks Dr. Somas for all the information. It's very detailed, and we have all sorts of information from Dr. Somas. And also Grace also give you a big applause.
Thank
you. You will mention about, you share about a lot of information. So thank you, Dr. Somas.
Thank you.
For the So any take-home message for the mothers for today?
The message is basically enjoy your pregnancy. All pregnancy are different, so enjoy the pregnancy. Look forward to welcoming the baby. Stay home and stay safe.
Yes, thank you. And for all of you who just came in maybe halfway, so you can look through the replay. And we have so at the bottom we have Dr. Somas' website, pregnancypenangdoctor.com. So you can actually view his profile and also some of his services and his successful story. Is very touching. Okay, so please search his website. And if you have any questions, so later we will drop down the Dr. Somas' Facebook, so you can actually ask any questions about pregnancy or delivery, or getting pregnant as well, and others kind of women's health condition. And for myself, Global Circle Physio and Rehab, we do have online antenatal class for pregnant lady, which is very personalized and customized for the pregnant ladies. And we do see pregnant lady or after delivery who they have some of the back pain or any musculoskeletal pain. So we deal with it. And next Tuesday, if you all are Chinese speaking, we do have a Zoom close meeting for pregnant ladies who want to know more about antenatal exercise. So later on, I will put down the information so you can fill up the Google form and you can join the closed group Zoom meeting. If any one of you don't understand Mandarin, it's okay. If you're keen to have any information about antenatal class or private or group antenatal class, please drop down +1 so that I can know who are interested. Then we may plan ahead if we find that the response is quite good. Okay. So thank you so much. Thank you, Dr. Somas. And
thank you so much.
Early wishes for you. Happy Father's Day.
Thank you.
Okay, thank you.
Okay, take care. Thank you very much. Have a good weekend. Bye.
Have a good weekend.
Bye.